Hi, this is Greg Johnson with Blue Book Services. I'm joined today by Molly Van Lieu, the Vice President of Nutrition at IFPA. And IFPA came out last week with what you called the moonshot recommendations. Basically, it's 8 big recommendations for improving fruits and vegetable consumptions. And we've had some analysis on Blue Book of the program. And I'm glad I have Molly here to expand a little bit. I think one of the most interesting ways to look at these recommendations are one, what's realistic, and two, what is the most promising? What could really move the needle on overall consumption among consumers? And it sounds like you kind of have one of your big ideas fits both of these.
Yep, that's right, Greg. Thanks for having me. So we really think produce prescriptions is the biggest and most exciting and promising component to these recommendations. Almost everybody has healthcare. We know that diet-related disease is a huge contributor to healthcare cost. 8 out of 10 healthcare dollars are related to diet-related disease. And the way that it's funded makes it a bit easier to scale than some of these other things that we talk about. So if we can get produce prescriptions as a dedicated benefit, and you can redeem it in the same way you would a prescription from your doctor, it's infinite, how far this can go. We see really great outcomes when people change their diet, particularly in certain diseases like diabetes. You can quickly turn around the consequences of diet-related disease through proper eating. And this is happening in certain pockets. North Carolina is doing it with their Medicaid populations. California is as well. And that's just Medicaid populations. But if we can get private healthcare insurers to follow this model, then we have the opportunity to reach the majority of Americans.
So the big thing about this plan would be it's not just government funded, but it would be funded by private health insurers with the idea that they would get their own ROI, right? So what is that like? Can you give an example of what that would look like?
Sure. So, what we see is typically, between Medicaid and Medicare, which is why we're focusing first on the federal government, between Medicare, Medicaid, TRICARE, which covers military families, VA, Interior, which covers Indian services, you're talking about 150 million Americans are enrolled in those programs. Again, if you can we could get the evidence to show, which we see in these pockets, that the federal government can save money because there are fewer hospitalizations, they're no longer having to be on certain medications. Then you can see that there's going to be a healthcare cost associated with that, and certainly private insurers want to see that as well. So they tend to kind of mimic whatever Medicaid and Medicare cover, because Medicare and Medicare have a really rich research base for how they cover things. So that's where we see the promise of health insurers kind of coming in and following suit there.
Okay, well, that's a better explanation than we did ourselves from our analysis. So hopefully our viewers get a little more insight into what that plan is. And we will be looking for some results and some recommendations to come out of that Washington meeting, which is, as of yet, the specifics aren't announced, but it's going to be in September in Washington, D.C. So I'm sure that you will enlighten us as to what they took from your recommendations.
Yep. And yeah, we feel very confident about produce prescriptions, but regardless of what comes out of that conference, we're going to keep advocating for these things. So it's a step in the process.
All right. Well, I appreciate your time today, Molly.
Great. Thank you, Greg.